Alright, so I'm going to be doing the anterior and posterior drawer test. It tests the anterior and posterior tibiofibular ligaments. So I'm going to stabilize above the malleoli and grip the calcaneus. And I'm going to shear to test the anterior tibiofibular ligament and to test the posterior tibiofibular ligament. I'm going to switch my hands and shear. I'm doing the subtalar tilt test, so I'm going to place my hand right above the malleolus and my other hand on the calcaneus. I'm going to evert the foot, which tests the deltoid ligament. And I'm going to switch my hands, and I'm going to test the calcaneofibular ligament and invert the foot. I'm doing the clump test. It tests for the anterior and posterior tibiofibular ligaments, and it tests for a syndesmotic ankle sprain. So I'm gonna firmly grab here, place this hand cupped around the calcaneus, and I'm gonna externally rotate the foot out. Alright, so I'm doing the Clogger test. So I'm gonna grab right above the malleolus and stabilize. Then I'm gonna grab the first MTP joint and the big toe, and this test for the deltoid ligament. And I'm gonna dorsiflex the foot and evert it, and then you come down here and you do it at the different points to test the different parts of the deltoid ligament. And the Thompson test. So I'm gonna grab the gastroc complex, the calf, and I'm gonna squeeze it, and the foot should plantar flex, and it tests for the Achilles tendon, and a positive test for this would be the foot not plantar flexing. I'm gonna be doing the Tindall sign special test. It tests for the peroneal nerve, and you perform this when the patient has weakness with their plantar flexion, dorsiflexion, or eversion. So you're gonna find the head of the fibula right here, and you're gonna percuss it with 2 fingers. And a positive sign of this would be paresthesia running down the leg. All right, so we're testing range of motion for plantar flexion here. So we're gonna, can you dorsiflex your foot? You're gonna put the goniometer on the lateral malleolus, and we're gonna measure get the foot starting at 90 degrees. And I'm gonna ask you to act like you're pressing on the gas pedal. And then I'm gonna passively push your foot. So he had about 52 degrees of plantar flexion, and the normal amount is around 50 degrees. All right, I'm measuring range of motion for dorsiflexion of the foot and ankle. I'm gonna place the axis on the lateral malleolus and the stable lever arm on the going up the tibia and fibula, and the movable lever arm lines up with the 5th metatarsal. And I'm gonna ask you to point your toes up to the ceiling, keeping it in line. And then I'm gonna passively push his foot up too. And he has about 30 degrees of dorsiflexion, and the average is around 20 degrees. So I'm gonna be testing inversion and eversion of the foot and ankle. So I'm gonna put the axis of the goniometer where the Achilles tendon and calcaneus meet, with the stable lever arm in midline with the calf, and the movable lever arm starts at 180 degrees. So for inversion, I'm gonna ask my patient to take his outside of his foot and try to rotate it towards his other foot. And he has about 8 degrees range of motion, and I'm gonna passively push his foot where he gets to about 12 degrees range of motion, and the average is anywhere from 5 to 20 degrees. And for eversion, same thing. The movable lever arm started at 180 degrees, I'm gonna ask my patient to take the inside of his foot and try to rotate it towards the wall over here, where he has about 5 degrees range of motion, and I'm gonna passively push his foot. He gets to about 10 degrees range of motion, and the average is around 5 degrees.